This is Tori Novak. This is going to be video 2 of mine for bedside spirometry. So this is the bedside PFT we use. It's called a Graphics Cardiorespiratory Diagnosis. It's just like a little box that you take with you to the patient's room instead of having them come to your PFT lab. It attaches to the laptop with a USB port, and then it also has this calibration piece also. So you calibrate the machine between each patient, between each use. So the calibration device is this 3-liter syringe. The calibrator will fit into there. There's a notch on one side, so you just make sure that the notches line up and it gets plugged in. And then it's already plugged into the laptop, which will give you a series of prompts to either inject or to retract. So you'll go through a series and you'll inject, retract, until it tells you that your machine's calibrated. Okay, and so when you go in, of course, you're going to introduce yourself to your patient. You're going to explain to them what you're doing. So, hi, Mr. Jones, this is Tori. I'm here from Respiratory. We're going to do a spirometry with you today. This is going to help us measure your flows. So I'm going to explain to you how to do these different maneuvers, and then I'll coach you through them. So you've washed your hands, you put on gloves, then you need to put your pieces together. So you're already plugged into your computer. You have a flow sensor, and you have a mouthpiece. You can kind of see here. So in the middle you have the filter between the two. This plugs in just like, plugs in this way, so the little holes go inside. So it plug in like this. Then you have your notches on the top, and this is going to hook your mouthpiece and your sensor all to the PFT or the spirometry. So it will be just like that. And so your patient's going to breathe in on this side. So they're going to breathe into this piece. So you want to make sure that your patient understands that when they use this, they need to have the mouthpiece in the mouth with the teeth around it and a nice tight seal with the lips. We're also going to use a nose clip to make sure that we don't have any air leaking. And we're going to instruct the patient that they need to sit up nice and tall, sit up straight with the feet flat on the floor. Before we begin the testing, we need to go through a series of questions with our patient. We need to know their age, their height and weight. We can measure them and weigh them. We also need to know their race. We need to know if they have anything that would prevent them from being at their baseline. So if they have an acute respiratory illness right now, they had a large meal, they've had dental work that wouldn't allow them to seal their mouth appropriately around the mouthpiece. These are all things that we need to know, because if that's the case, it may not be the most appropriate time and the results might not be accurate. So once we go through our series of testing with our patient, we go ahead and we put the device together, we put the flow sensor, we have everything ready to go for our patient. And then we're going to start. So we're going to say, okay, Mr. Jones, the first thing I want you to do is sit up nice and tall for me with your feet flat on the floor. I want you to go ahead and put that mouthpiece in your mouth and the nose clip on. And I'm going to instruct you on what we're going to do. And so you tell him what we're going to do for slow vital capacity, and then we're going to coach him through it. So, okay, Mr. Jones, I want you to have some nice, easy breathing. So just some nice, normal breaths. And we'll have him do that for at least 4 tidal volumes, more if needed. And then we'll say, okay, I want you to fill your lungs. So take a deep, slow breath in and fill those lungs up as much as you can. So in as much as you can. And then I want you to slowly exhale, blow it out. And I want you to blow until you can't blow it anymore. Okay, and that's 1. So we're going to repeat that test at least 3 times. We're looking for results that are within 5% of each other. And once we get that, we can move on to our next test. So the next test we would do would be forced vital capacity. For forced vital capacity, you instruct your patient the same. Sit up straight and tall, feet flat on the floor, mouthpiece sealed tightly with the lips, nose clip on. And you're going to instruct the patient on what they're going to do. And then you're going to coach them through it. So, okay, Mr. Jones, I want you to start out with some nice, easy breathing. And you wait for those 4 nice tidal volumes. You wait longer if you need to. And then you say, okay, I want you to take a deep, fast breath in. And you, and in. You want them to fill those lungs, and then you want them to blast it out. So you say, blast it out, and they blow as hard and fast as they can to get that air out. And you have them blow for at least 6 seconds, and then you tell them they can take a deep breath in. So those are going to measure the volumes, or excuse me, the flows. And then if you're doing a post-treatment, you'll administer that bronchodilator. And then you'll wait until it's working. And then you repeat these tests. You can also do the MVV test. My site does not do that. They do the pleth for a full PFT, but that's inside the box. But for MVV, you would instruct your patient to take deep, fast breaths. So you would have them do like that. And so you would coach your patients through that. You want to make sure that you're always giving them appropriate recovery time, because you don't want them to get lightheaded, and you want their best efforts. So to do any of these tests, it's important to give your patient recovery time so that you're able to get the best results.